It can be a flutter or unusual heart palpitations, which could mean AFib, atrial fibrillation. Cardiologist Dr. Tarakia is here with more important information. Good morning.
Good morning. Great to be here.
Well, this is an important discussion to have. As we speak, I have a dear friend in the hospital battling AFib. So explain to us what it is and what the signs are.
Well, that gives great context, Angie. Atrial fibrillation, or AFib, is an irregular and often very fast heart rhythm disorder. Some people are aware they're having AFib the minute they go into it. Their heart races, they feel palpitations or a fluttering heart. Some people can also feel shortness of breath or get lightheaded. But sometimes patients are unaware of AFib. Maybe they're a little fatigued or get more winded and don't think anything of it. Others feel nothing at all. And it is subtle in the early stages, especially because it comes and goes. But the fact is, any person can develop AFib. The risk goes up with age, especially over age 65. But there's other contributing risk factors like high blood pressure, being overweight, and diabetes. In the U.S., there's about 3 to 6 million folks who have AFib. That goes up to 12 million by 2030. But there's also 1.5 million adults today who don't even know they have it, and that's why I'm here today with you.
Well, that is, those are sobering statistics for sure. So what tools and treatments are available?
Yeah, it's important to understand that even if symptoms are not noticeable, AFib can increase your risk for stroke and heart failure, and that's important because it's readily treatable with these complications being preventable. And so awareness, early detection, and diagnosis are vital. Now, the way to get a diagnosis is with an electrocardiogram, and that is an electrical photograph of your heart that really captures the exact time you're in AFib, which can come and go. Now, it wasn't long ago that you'd have to come to a doctor's office like mine and get connected to a bigger machine with wires or go to the emergency room. But what's really amazing is that these technologies have miniaturized, and now we have medical-grade monitors that you can wear right at home. They record your heart signal, not for 10 or 30 seconds, but for up to 14 days to capture things that come and go like AFib. At iRhythm, we have our Zio monitor, Zio. It's a patch you place on your chest. It continuously records up to 14 days. And it can help your doctor make that diagnosis of AFib or other rhythm conditions, or give you the peace of mind that you're in normal rhythm.
Now, is this a device that we have to have a prescription for?
Yeah, these are medically prescribed devices, as ours is. And so the reason for that is if a patient is feeling unwell and having symptoms or has risks consistent with possible AFib, not everyone's going to have AFib, but that conversation that you initiate with your doctor or care team can lead them to prescribe the right diagnostic for you. To really get to making a diagnosis or ruling it out.
You know, I know many smartwatches and other devices have heart rhythm, platforms, but this sounds like it's far more specific.
Well, they kind of work as a continuum. And so smartwatches, you know, we all have them there, and there's other consumer devices that can alert someone to possible AFib, an irregular pulse. But they're often what's called a pre-diagnostic. So you still need confirmatory ECG to make that diagnosis. And sometimes these watches can give you that ECG that you transmit, but it's really tricky for a condition that comes and goes. And that's why prolonged monitoring up to 14 days is a better tool to capture it if there is any suspicion of AFib.
Well, I'm excited to know that is available and on the market. Can you send our viewers to a website, please, where they can learn more?
Yeah, so Melanie True-Hills is an AFib patient and advocate, and she's created a wonderful website called stopafib.org that really explains the condition, symptoms, what can be done about it, what treatments are available, and to guide patients and family members through that journey. The important thing is, really, if you think you might be having these symptoms or are concerned, it's worth having a conversation with your doctor and checking out the website.
Thank you so much for all of this life-saving information. We appreciate it.
Thank you. Pleasure to be here.
And we'll have more local lifestyles right after this.